What are the health apps that add most value to patients and what makes them successful?
What we found from our research into what patients want from apps is that there are 5 key attributes that they cite as the most important reasons for them to use apps. And that is one, that it helps them manage their condition, whatever that particular chronic condition can be, that the app is easy to use, that it's trustworthy, which is very important, that they can use it to network with other family members or carers or friends or fellow sufferers of their particular condition or with their healthcare professional, and that they can use it regularly. And those are the 5 main reasons we found for a success of an app.
How does the site myhealthapps benefit both its users and health professionals in managing individuals' health?
What we've tried to do with the site myhealthapps.net is help patients and carers and anybody interested in maintaining their general health find in an easy way apps that could be relevant to them. So only apps that have been recommended, tried and tested by patient or health consumer groups are uploaded to the site. We also try to make sure that as much information as possible is provided about each app, because one of the key issues is trust and patients not knowing which apps to trust. So we provide information about the app developer, links to that app developer, information on who funded the app, whether it had a medical advisor if that was necessary, and whether it has any kind of regulatory approval such as the FDA or CE marking, again if it's necessary.
What are the major hurdles to the uptake of healthcare apps?
From our research, one of the main problems that patients regularly cite is the sheer number of health apps supposedly available on the health market. And it's very difficult even to come up with an accurate number. Estimates range from 100,000 to 150,000 health apps. And even research which IMS Health, which is an American data company, carried out a couple of years ago into all the apps that were classified as health on the iTunes site, they discovered at that time 43,000. Only 16,000 had anything to do with health at all. So it's extremely difficult, and the situation is probably worse now 2 years on. So that is one of the major reasons. The other difficulties are trust. As I mentioned earlier, people don't know who has funded the app, who has developed the app, who's behind it. There's not enough transparency of information. Some of the other areas are some patients prefer face-to-face time with their doctor or nurse. They don't want to communicate by some kind of mobile device or collect data that way. And that's not just some of the older members of society, it can be across the board. Or they see it as a threat that the clinicians and healthcare systems will use apps as a way of diminishing the amount of time they spend seeing in face-to-face time, which is a fear, which is not unfounded, but it's one of the fears that's come about. The other 2 big issues, I think, are that healthcare professionals themselves aren't sure which apps they should be recommending or supporting. And so there's not the ability for them to be able to communicate with their patients in that way. And the last thing is the longevity of apps, particularly ones where we're now beginning to collect more and more data. What happens if the app developer discontinues that app? What happens to all your data? Is there any way to preserve it, to make sure it's safe, to be able to transfer it to some kind of other app or other device? These are all issues that need to be addressed.